Great. Welcome, everybody. I'm Dan Warner, co-founder and CEO of KixCare. We are Canada's first online clinic for kids 0 to 18. We focus on ensuring that families right across the country, starting in Ontario, Quebec, have somewhere to turn to when they have questions with regards to their children's health and well-being. That mission that we're on to help parents raise healthy, happy kids led to us engaging with our partners at Sick Kids and PTPA Media and CHIO to create a special event for Bell Let's Talk Day. The past 2 years have been immensely challenging for parents and children alike. Everyone's doing the best they can to make the best of the situation and keep our heads above water. And we need to have more meaningful conversations to be able to support parents, to support kids. And we're very grateful to have such an amazing group of expert panelists joining us here today. So just want to say thank you to a number of our participants and sponsors for today, Sick Kids and CHIO for joining us, Daddy Digest and the Kids Sleep Clinic, and of course our co-host KixCare and Parent Test and Parent Approved. So on that note, I want to thank you again, and I'd like to introduce the CEO and founder of PTPA, Sharon. Thank you, Sharon.
I am founder and CEO of Parent Tested, Parent Approved. We are really proud to be a part of today's initiative. There is nothing more important than our children's mental health. Parent Tested, Parent Approved has a community of over 200,000 families. So we were anxious to participate in this and put together some great, amazing speakers and resources that will help have a positive impact on the lives of parents and their children. So just to give everyone a little bit of background about how this is going to run, I'm going to do a really brief introduction of all of our speakers. And then each speaker is going to have about 5 to 7 minutes to speak to you about either the latest research, insights they have, and hopefully some actionable items. We want parents to be able to leave today with information that is going to positively impact their lives. And then after all of these presentations, we're going to do a Q&A. So as you can tell, we have some pretty amazing speakers lined up for you, and I'm going to get right into this and get started with Dr. Edward Less and Dr. Catherine Smart.
Thank you, Sharon. Thank you, Dan. And welcome to everyone who is on this call. And I have to say, particularly the many families that have joined us today. Those of us who are pediatric healthcare professionals, we are just now beginning to understand really the enormity of what, let me put it this way, we have done to our children via our response to the pandemic. I'm so privileged to be part of this discussion to begin to shine a light on the enormity of this issue, and hopefully to brainstorm for solutions. It's one thing to recognize a problem and to talk about it and to write reports. It's another thing entirely to take action. And our goal by bringing this project together to start a conversation around this is to generate some action items. I ran across a great quote the other day that said something to the effect of, health is more than the absence of COVID. Health is more than the absence of COVID. And clearly, via the various restrictions we have put in place and the level of anxiety that we have created in our society around COVID, our children are being harmed with respect to their mental health. There are good studies around the world now looking at this. In some, the rates of depression, anxiety, and eating disorder have at least doubled. And as we all know, in Canada, prior to the pandemic, our healthcare system was already strained with respect to having adequate resources to deal not just with mental health issues, but with so many things. And with a doubling of youth mental health issues, the challenge will be, how are we going to begin to address this problem? What strategies can we take collectively as we pull forward together to recognize that we have to take this seriously? There is, I would just say, before we get into, the meat of this discussion with our talented panelists, one thing I would hope we can do, despite the polarization out there, despite the politicization of so many of these issues, I hope that we can begin to come together in a manner that is collegial and always rooted in facts and science as best as we can understand them at the moment, and recognizing that science, by its very nature, changes opinions based on the facts on the ground as we move forward. You take, for example, the issue around vaccines and the much discussed leaky vaccine, this idea that if you're vaccinated, you can still become infected, and therefore, according to one current of thought out there, the vaccines are not effective. That is simply not true. Absolutely, the vaccines are not preventing people from becoming infected, but the vaccines are doing a stellar job of preventing vulnerable people, primarily the older adults, from getting seriously sick, ending up in hospital, in the ICU, or dying. So the vaccines have been a smashing success story. It is true that people are becoming infected. It is also true that throughout this pandemic, our children have not been at high risk from infection with COVID. The risk from infection with COVID in kids in general has not risen to the level or much beyond the level of a typical flu and RSV season. RSV is a virus that causes bronchiolitis. And those are the facts as best as we can understand them today. And that hasn't changed with the arrival of this more infectious variant. The Omicron variant is infecting many more people, including many more kids. And therefore, because of the increased volume, we are seeing some more children in hospital. But we are seeing larger numbers in my institution of children admitted with typical RSV bronchiolitis, which is a typical viral infection that impacts kids. And those of us who have worked in pediatrics for a long time, we recognize that most viral illnesses in kids require nothing more really than supportive care, some comfort measures, Tylenol or Advil for comfort, and what I call tincture of time, the passage of 7 or 10 days and they get better. But let me assure you, these issues that have cropped up with anxiety and depression, eating disorders, and so on, those things can't be fixed with 7 to 10 days of antibiotics. Those will require a long time to unpack and to remediate. I liken it sometimes when I talk about this in public to a freight train. You know, a fully loaded freight train takes quite a long time to get moving. At first, you can't even tell that it's starting to move. But let me tell you, once it's moving at full speed, and particularly when it's on a decline, it can be very difficult to stop. It can be done, but it takes a while. It takes substantial effort. And we are on that decline now. And it's time for us to take this seriously and to begin to address it. And so with those brief comments, I'll just hand it over to Dr. Smart, who has been a tireless advocate for all things pediatric, but particularly with pediatric mental health in her wide experience across this country and internationally. Thank you, Catherine.
Thanks, Ed, and thanks for your words. First, I just want to start by saying welcome everybody today. I think this group has put together a fabulous panel, and I absolutely agree with Ed. I think it's incredibly timely. I know how hard it has been for parents over this past 2 years. In addition to being a pediatrician, I'm also a parent of 2 youth. And I don't think there's really any family who hasn't been impacted by COVID in some regard, and particularly when it comes to mental health. And I think for many people, it has been an emotional roller coaster. And nothing is harder for parents than worrying about the health of their children. And I know for all of you that are tuning in today, that has been top of mind. And I think, as Ed said, I think one of the spaces we've really struggled with when it comes to COVID in children is sort of acknowledging that two things are true at the same time. As Ed very clearly articulated, COVID is really not presenting a much higher risk to children in terms of their acute health than the other respiratory viruses that we're very used to dealing with as pediatricians. And I think it's been a lot of real scare tactics directed at parents to make them really feel disproportionately worried about the risk for their children. And I think that's made it very hard for parents who are looking at all the public discourse and the decisions by government to ever really feel like their children are safe. The reality is we now have a very effective vaccine for kids 5 and up, which should allow our children to be in school very safely. It's providing excellent protection against that very rare outcome. And again, want to emphasize it's rare, as most children who get COVID will have a typical course like any other viral illness. But those children, and we don't want to minimize that, of course, we want to prevent any bad outcomes that we can, and the vaccine's very effective at doing that. But I think along the way, we've lost a bit of the context that all the other things that we're doing are actually impacting all children. We've seen extensive service shutdowns, we've seen many children not able to go to school, and we've seen a lot of community-based services for children interrupted. And that's impacted people's development, that's impacted mental health services and supports, and it's impacted the normal social aspects of children's lives that are so important for protection. in terms of their mental health. And of course, in parallel to that, we've had their parents who have been stressed, trying to manage work, trying to manage kids being home, their own concerns about their health. You may be caring for elderly folks in your own family or have your own underlying medical problems that have made you particularly worried about COVID. So there's been a lot of things happening in parallel. So as Ed said, our work at the CMA has shown very clearly that the mental health of all Canadians has declined significantly during this pandemic. And I don't think that's any surprise. But unfortunately, when it comes to children and youth, I think what we have seen is not enough centering of the needs for children and youth in terms of our response to this pandemic. We have been so concerned about the impact on the acute care side of the system, and not to minimize that because that is significant and it's been extensive. But often in those conversations, we've lost track of what is happening to children and youth and what resources are being put in place to address this freight train, as Ed aptly said. So right now at the CMA, one of the things we're really focused on is really two things. One, continually bringing to the government's attention the importance of advancing some of the election promises we saw around mental health and making sure that those resources are available for children and youth. Is right now so much of that care falls outside of what we consider a universal but not really healthcare system. And that's a huge issue, and we're advancing that daily. The other piece is really trying to bring forward conversations about what we want our health system in Canada to look like. We know that really what universal healthcare is in this country is doctors and hospitals, and that is not where most children with mental health challenges end up. So it's very critical that when we think about mental health in children, we realize this is an extensive problem. It's impacting children from infancy through to adulthood. And we need to have robust systems in place in our community that are timely, accessible, so that all children can get the supports they need and we don't end up with a generation that doesn't recover or meet their full potential because of this pandemic. So I'm really grateful to this event today. I think it's critical. And for parents, I just want all of you to know you're doing your best, and that's all any of us can do right now. And the fact that you're here means you're going to be part of the solution. So thank you so much.
Thank you. I really appreciate, number one, that Dr. Les, that you debunked any myths that were out there in terms of the vaccine, because that's a great starting point. I think that is one of the most common questions. And Dr. Smart, knowing that there is an advocate like you heading up CMA, but also speaking on our behalf as parents to the government and trying to make them keep those promises that they've made to us and make a difference for us, I think is incredibly valuable, but it also gives us a lot of hope as Canadians. So I am going to move on now to Leanne Matlow, who is going to be giving us a little bit of background with her experience in cognitive behavior.
So thank you. Good morning, everyone. And a special thank you to KixCare and to PTPA for inviting me with this incredibly esteemed group of colleagues and professionals. So I concur and agree that what we have done is really created, focused a microscope on something that was probably or really was already there. Any of us who work in mental health know that there's been a crisis and an access to service issue for many, many years. And yet what COVID has done is put the spotlight on it. But I want to frame this in a really positive way by saying, I'm actually happy about that, which sounds ironic, except that now we have put this issue on the table where people are no longer scared to have this conversation. And I spend most of my day working with children and adolescents, and they want to have this conversation. So I feel like it's wonderful that the adults in the world are finally catching up to it. But we do have, in my opinion, three big things that we need to do. One is to end the stigma. Like I said, I feel that the kids are ready to have these conversations, but we need the parents, and I feel like they're finally on board to focus their attention to this, and the government and all the powers in education. Second, we need to build community, because more so than anything else, all of these, going to Zoom school and the end of your hockey tournaments and no graduation, what these have done is isolated children, and children are feeling very alone. Parents are feeling very alone, and they do not know how to manage it. And the last thing we need to do is to educate people. So I want to spend a few minutes trying to give you a little bit of hopefully some practical tips of things that you can do right now. So at the core of anxiety, what we find is one really important word, which is uncertainty. And because of cell phones and because of technology, the generation that we are focusing on today is used to having information at their fingertips quickly without really too much work. They're used to knowing things quickly. And what we have done in the last 2 years is entered an entire world of uncertainty. Am I going to school? When we're told Friday we're going, and then kidding, Monday. And even the day we went back last week, the next day was a snowstorm, as if the world laughed at us even further. So what we need to do is help children understand that they can deal with uncertainty. And we need to be modeling that as parents. The other big word is about control. And there are really very few things in the world that we can control. And this pandemic has shown us that more than ever before. What we can't do is fall into a feeling that because we can't control it, there's no point. And what I'm hearing a lot from kids is, what's the difference? What's the point? Which is really, a very worrisome statement. So few things that I would suggest to parents out there. One is acknowledge that this is hard. This is hard for your student, your client. This is hard for your child, and this is hard for you. The other thing is that all feelings are valid. So when parents call me and say, my kid's really angry, I'm okay, good. Anger is a normal human emotion, and we have to allow kids to be angry. We have to allow them to be upset. The question isn't to stop them, or the goal isn't to stop them from feeling their emotions. The goal is to find a productive way to handle that anger, because all human feelings are valid and we want them to share them. We don't want them locking themselves in their room and developing other bad habits, because one thing that hasn't been mentioned yet today, which may come up later, is a rise in substance abuse, which is another, and addiction. And that addiction can even be to gaming, which I'm seeing a lot of in my clients. So what I would tell parents to do in 3 minutes or less is a little bit of cognitive behavior therapy. We are very busy as adults. We are always asking people how they're feeling. And that's really important because all feelings are valid. We're very, as teachers and as parents, we're very fixed on what are you doing? We're fixed on people's actions. And sometimes what we need to be looking at is what they're not doing, because at the hallmark of anxiety and depression is avoidance. We have to look at them. Are they engaged? How can we help them be engaged? Asking those questions. And the final, and I think the most important thing, is asking them what they're thinking. And we don't really teach children to look at their thoughts, but we need to, because what they are thinking will open up our eyes to the core of what is really worrying them, So children seem very worried now, am I going to see my friends again? Am I going to get sick? Are my parents going to die? A whole series of very important, significant questions, which is helping fuel this mental health crisis, which when analyzed either with a parent who can sit and have that conversation with them, a cousin, an aunt, a teacher, some adult, to help them try to challenge those thoughts. Is it true? We just heard from a leading expert that most children who get COVID are not going to die. And we need to be we need to be giving them proper messaging. You may get sick, you may have to be away from school for 5 days, or you may miss out on this, but the thing that you're most worried about isn't really going to happen. And teaching them, once they've analyzed those thoughts, to check whether their thoughts are true. Are they helping them? How is it holding on to that thought is limiting your access and your success in moving forward and getting on with your life, and helping them reframe their thoughts to more realistic and balanced thinking. Our goal here is not eradicating all negative thoughts. Our goal here is to have more balanced thinking. And to have balance in our lives, we have to promote other skills. We have to exercise, get some fresh air, I've said to so many parents in the last weeks, now thankfully they're back at school, but when they were off, there's no reason why recess can't be outside on the driveway or, in the courtyard of your apartment, getting outside, getting some exercise. Because we as parents, we as humans are extra stressed, we're overwhelmed. I call the kids prickly. And on a daily basis, we have to help kids bunch and group their activities into small, and parents do this too, what you have to accomplish by the end of the day, what you should accomplish by the end of the day. And it would be nice if I had this as well. And putting our lives into manageable components that we can actually be successful at. One of the things two things, and I'm going to stop in a second, but two of the things that I think are really missing and the things that I'm worried about for these children is they don't have those successes because of the masks, and because of this, they're missing the smile from the teacher or their friend, good job, those nuances that are being missed. And we need to create opportunities without the hockey tournaments and without some of those things to be successful. And the other issue I just want to raise is that we have to have some education around some of the soft skills. What else are we missing? Feeling part of a team, building empathy, encouraging children to reach out to their friends. Girls are really good at it, boys not so much. Putting up a TikTok does not necessarily, I would not constitute that as reaching out for a friendship experience. And we do have a lot of work to do to build some of these skills. So it can be done. And days like today and conversations like now help us focus on the real practical things that we need to come together and do for our kids.
Thank you. That was fantastic. One of your first points is about acknowledging their feelings. As adults, we want our feelings acknowledged, and we don't want everybody just coming up with solutions for us. Our kids completely need their feelings acknowledged, especially when they're teenagers and you can't ask them what they're feeling or thinking because they're not going to share that. So I think there's so many valuable takeaways. Hopefully everyone was taking notes. If not, again, we are going to be sending out a recording hopefully in the next week or so. And that brings me to our next speaker, Dr. Harley Eisemann.
Thank you. I just want to take a moment to thank everybody and all the participants and the parents and healthcare professionals who are with us this morning. I think this is an incredible forum for conversation and certainly for tips that everybody can take forward to their families. And I want to echo what Ed and Catherine has already mentioned. From my perspective, both treating patients in the pediatric emergency department and in my community office, COVID obviously is something that we have to be mindful of, but by far and away, kids are doing very well. It's a self-limited illness. And really a modicum of a moment of reassurance to parents and families. I think as well, there's a lot of unnecessary discussion, anxiety about vaccines and stuff. Some of that is even transmitted down unnecessarily to the kids themselves. As Ed has alluded to, vaccines are extremely beneficial. And I think we have to direct the questions and energies on the vaccine issue to items like mental health. I think an important aspect, and what I try to do when parents come to my office, tears with unbeknownst to them, a mental health issue that they were not expecting. Is to reassure them that they are amongst what unfortunately now is a normal fold. As Ed has mentioned, as Catherine has mentioned, studies that have done by my colleagues in our emergency department and across Canada, there really is an explosion of COVID-related mental health issues. No one is left untouched. I'm no mental health expert, but I think the bottom line is, there's adversity, whoever you are, whatever social class you're in on a daily basis. And COVID, in essence, has limited our usual coping mechanisms. Our routines are off, what we do is off, the routines for our kids and families are just not there. And there is resilience still available. And part of what we have to do, as Leanne has mentioned, is sort of to channel strategies to that available resilience to help parents and families. Again, parents have to know that unfortunately this is what the new normal is, and it's okay to come forward with your problems to your healthcare professional, and it's okay to talk and speak about it. Part of the pearls that I try to teach in practice, and these are pearls that I'm still learning as a parent. My wife and I are parents of 3 young adults, 2 young adults and an adolescent, and a lot of this learning, I think, and reinforcement comes from my wife, who probably is the more astute parent than I am. Is that as parents, what kids and families look to us is to set the goalposts and to set the boundaries and to enforce that structure. And I think it's so important, and even more so during COVID. As parents, we have our own stuff that we're dealing with, but I think that we have to take a moment and ensure that whatever the situation is and however the situation is different, to be able to be that goalpost and to set the boundaries for our kids and young adults, because they are looking to us for that guidance. And as parents, and we see this in the office all the time, anxiety will be transmitted to your kids and young adults. So it's really an effort to try to maintain structure, and I think, as Leanne mentioned, to evoke strategies to ensure that structure and to be innovative during this time. And I think, as Leanne already alluded to, and one of the first things we can do in terms of a strategy is create a forum for our children and adolescents to know that it's okay to talk, it's okay to express their feelings. And parents often come to me in my office and sort of angry at their kids because they found out through back channels that their adolescents were lying or not owning up to the truth about their feelings. Parents have to understand that the developmental stage that adolescents are at is they're trying to figure out some sort of autonomy, and they don't want to burden their parents. So I think that parents have to set the structure for non-judgmental conversation. I often recommend, as I think Leanne alluded to, a trusted family member, a teacher in a school, or a parent themselves, a pediatrician, a healthcare provider, a social worker, a guidance counselor, where the young adult feels that he or she can go and express his or her feelings in a non-judgmental fashion. And just a brief anecdote. Again, I have the privilege of caring for patients in the emergency department in my community office, and more recently on our KixCare platform. And I had the opportunity to meet a young adolescent female and her mom who called because she has been depressed and has been withdrawn for 3 or 4 months. And as Catherine has alluded to, as pediatricians, certainly we're emancipating skills that we haven't necessarily been taught in terms of being, offering mental health advice. And really the best I could do for that adolescent was to be there on a bi-weekly basis to chat. We did talk about medication, and I finally brought her into my office for an in-person visit. And we talked about medication again, and her and her mom said that, she's doing better. And it was really just the opportunity to talk and to have her feeling validated in my mind that made the difference. And certainly that was great learning for me. And I think that if we can, as a first order, somehow increase the capacity where kids and adolescents can talk, then we would really be doing a great service. And again, as Ed and Catherine has alluded to, I think part of the going forward is, as a pediatric community and as advocates for adolescent and child health, is to really figure out ways of enhancing capacity for mental health services. People like Leanne, like Pam, like Erin are certainly in short supply. And I think we certainly have to be innovative in our strategies to provide access to more patients and families. So I look forward to the great conversation going forward.
Thank you so much. That was really valuable. I think one of the big things that I took away from this is at the beginning of COVID, nobody was enforcing structure because we felt so bad for our kids that we didn't want to institute a bedtime or limited numbers of hours online. And all of a sudden that fell by the wayside. Kids of all ages are going to bed at 2 in the morning, 4 in the morning, not getting proper night's sleep, not having routines. So I think going back to the concept of enforcing that structure is incredibly valuable. So thank you for highlighting that. Next, we have Dr. Erin Romanchik.
Right now? Yeah, okay, great. All right, so I'm going to share a couple of slides for our discussion today. So thank you so much to KixCare and PTA as well for inviting me to be part of this panel. It's quite a privilege to be here with so many parents and families and professionals. I really appreciate that. So in my role as a clinical psychologist in the psychiatry department at Sick Kids, I have an opportunity to provide a lot of assessment and treatment for children and adolescents with anxiety and mood disorders, obsessive compulsive disorders, emotion dysregulation, somatic symptom disorders, and certainly working in the past couple of years with youth and their families. I have witnessed a lot of this very significant difficulties around mental health during the pandemic. And so I hope to share some insights around that with you today. So as Sharon alluded to, we know that routine, structure, consistency in day-to-day lives are incredibly protective for mental health. And so the significant disruption that our youth have experienced during this pandemic in their daily lives due to lockdowns, due to restrictions, has really had a very significant impact on things such as physical activity, sleep, as Sharon was just talking about, social interactions, and of course, mental health. So what do we know? What does the research show us about children and adolescent mental health during the pandemic at this time? So research from a COVID and mental health study that's led by 4 research teams in Ontario. So the Sick Kids Child and Youth Outpatient Psychiatry Program, Target Kids, Spit for Science, and the Province of Ontario Neurodevelopmental Disorders Network, with Dr. Daphne Korchak as the primary investigator, has really highlighted some striking findings. So more than 70% of children and adolescents between ages of 6 and 18 have reported worsening mental health. And almost 2/3 of younger children between ages 2 and 5 are also reporting worsening mental health. I'm just going to share a video clip quickly, just to show some of those findings. It's a silent clip, so I'll just read it out loud so that everyone has the opportunity to hear it. So, new preliminary findings from our COVID-19 mental health study. So the COVID-19 pandemic has been a series of waves. Yet heightened depression and anxiety among children and youth have stayed consistent. Vulnerable families had greater economic hardship as a result of the pandemic. These families experienced higher level of caregiver and child mental health symptoms and stress. Caregiver mental health and family functioning was also impacted by children's mental health difficulties. Loss of in-school services resulted in worse mental health outcomes for kids. More time spent online learning was associated with increased depression and anxiety. More time watching TV on digital media and video gaming was associated with more hyperactivity, inattention, irritability, depression, and anxiety for all children and youth. Before COVID-19, 58% of children and youth participated in school sports or extracurriculars. During COVID-19, only 27% participated in sports and 16% in extracurriculars. About 50% of children and youth found the change to sports and activities hard or very hard. So the data shows that kids and youth need safe, in-person, as well as recreational, physical, and social activities. So really just wanting to highlight some of the real challenges that we are seeing firsthand with our children and adolescents right now. Additional findings from the COVID-19 mental health study have found that the screen use has been much higher than the recommended 1 to 2 hours a day. And those recommendations come from the American Academy of Pediatrics and Canadian Pediatric Society. We also had been finding children with more screen use were reported to have worse mental health outcomes. So in young children, higher TV or digital media use was associated with more conduct problems, more hyperactivity, more inattention. For children in the school age 6 to 18 years, higher TV viewing or digital media was associated with more symptoms of depression, anxiety, irritability, and inattention. And finally, higher video game use was associated with more depression, anxiety, conduct problems, and inattention and hyperactivity. So what can we do to help, given the number of youth in need right now? So putting on your oxygen mask first. So I know masks is a big topic these days, so I still come back to the oxygen mask analogy. And so this works for parents, for caregivers, and also for healthcare providers. You know, taking care of our own mental health and well-being during uncertain and prolonged difficult times is quite a powerful tool in supporting our children. So it models to them how we can express and cope with difficult feelings. Taking time for basics, so thinking about nutrition, sleep routines, exercise, and fresh air for yourselves. Paying attention to your own stress, noticing when you're starting to feel overwhelmed and taking a break. Taking a few slow, deep breaths when you start to feel anxious or upset. Being compassionate with yourself. So as we've heard from numerous speakers today, parents and caregivers, you are doing the best you can right now. Focusing on things that are in your control. We know there are so many things out of your control these days, so many things that are uncertain. So focusing on the few things that are in your control helps to model to our kids positive ways of coping with stress. Communicating with youth in a clear, calm, and consistent manner that validates all emotions and all experiences that they're going through are fine and normal and acceptable right now. And finally, I've listed a resource at the bottom that can be found on the About Kids Health website, so Parenting During COVID-19 and Beyond podcast. Ways that we can support our youth with this pandemic fatigue as the waves carry on. So listening and validating to their concerns. So for example, you've made it through tough times before, and I know you can do this again. Encouraging healthy anxiety tools, so relaxation strategies, using realistic thinking, and reframing some of our negative thoughts. Encouraging healthy daily activities, movement breaks, connecting with peers, building healthy sleep routines. Taking a social media break, so having some screen-free times and engaging in safe in-person activities. And finally, encouraging them to learn a new skill. So if you can think of a hobby that they may have wanted to get into before, maybe something that you can do as a family. And finally, out of the COVID-19 mental health study, there's been some screen time recommendations that I just wanted to highlight. So adopting some screen-free playtime with young kids when you're interacting or playing with them. Monitoring your own personal screen use in front of children, prioritizing some screen-free time, so including meals or at bedtime, incorporating movement while using screens, so for example, exergaming, standing while using handheld devices, or engaging in online workouts. And finally, promoting healthy screen use, where you can emphasize screen use for social interaction, online education, and new skills. And finally, some additional resources that may be useful to families. So a couple of websites, the Anxiety Canada, Healthy Mental Health, and About Kids Health websites. In the Toronto area, there are some walk-in clinics and access points. And then there's a free online CBT program available to use 16 and And finally, I just wanted to highlight that, if you are, significantly concerned about a youth's mental health, to start with a family doctor or pediatrician for referrals to mental health professionals.
This is fantastic. Thank you so much. Such valuable resources. When I think about it, I feel like breathing, which is something we all intuitively know how to do, is almost a practice that I wish everyone was properly taught at school. I remember when my kids were little, they used to do something called cookie breathing, which, for those of you who don't know what that is, it's deep breathing in order to help calm you down, which is such a basic skill, but it's probably such a helpful skill, which is why they've been recommending it for so long. Also, the screen time, when you have teenagers, that is so much more difficult, but we've implemented that in our home. We have dinner together every single night, and there are absolutely no phones allowed at the dinner table. So there's little ways to start implementing it, and I love those points that you brought into the conversation. So thank you very much. Next up, we have Dr. Pamela Middleman. Thank you so much for joining us.
Thank you, guys. Thank you so much for having me here. It's really nice to be here having this conversation just in regards to deep breathing before I go ahead and get started. So I'm a clinical psychologist and I specialize in behavioral sleep problems. And so obviously deep breathing and different relaxation strategies is, very much incorporated in my practice. And for young kids, what I do is I tell them, smell the flowers, blow out the birthday candles. Smell the flowers, blow out the birthday candles. Just for you parents of young children, and for older children, a visual aid could help. So put your hand up, take a deep breath, breathe in, breathe out, breathe in, and breathe out, and to repeat that process a few times. So I just sort of wanted to piggyback on that. I'm going to go ahead and share my screen with you guys. So like I said, I'm a clinical psychologist and I work with kids with sleep problems. So I run a clinic and I consult to KixCare, focusing on children of all ages 0 through 18. So I just want to share some slides with you. And what we'll be talking about today is I'll be defining what behavior sleep problems are, the importance of the impact of sleep problems on our children. We'll look at sleep needs by age. We'll look at healthy sleep habits, and then I'm happy to answer any questions. So, just in terms of what are pediatric behavior sleep problems, we usually think about it in 3 categories. So behavioral insomnia of childhood, psychophysiologic insomnia, and transient sleep disturbances. So behavioral insomnia of childhood or teenagers, what that's really referring to is looking at how do we fall asleep at night. So what is sort of a necessary condition or necessary association for the way in which we fall asleep at night? So for younger children, that might be parental presence, having a parent there in the room with them, having a parent check on them. For teens, what that might look like is falling asleep on a device or, some sort of external source that's needed. And usually the root of that is inadequate limit setting. So, it's easier for a parent to stay with their child until they fall asleep. So they go ahead and they do that. Or it's easier for a parent to just tell their teen, oh, whatever, just be on your phone until you fall asleep. It doesn't really matter. Psychophysiologic insomnia is another type of insomnia that we see, and that's conditioned insomnia. So that is really worrying about having a sleep problem. So sort of that classic, insomnia where you get into bed, where you worry that you're not going to be able to fall asleep even before you go ahead and get into bed. And then once you're in bed, lying in bed thinking, oh no, I'm not going to be able to fall asleep. I'm not going to be able to fall asleep. Sort of that loop, that cognitive loop associated with insomnia. And then transient sleep disturbances are really situational sleep disturbances. So there's an identifiable stressor or identifiable reason that a child or teen can't fall asleep. Okay, so let's talk about pre-pandemic. These numbers are from studies from the 2000s, and my experience tells me that it's a little bit higher. But school age, 20 to 40% of school age children, 6 through 12, were having sleep disturbances pre-pandemic, and 11% of adolescents. But again, my experience is, I think it was higher. But the point is that there's been a considerable increase during the pandemic. So many parents have perceived that their sleep has worsened, by about 40%, and they really attribute increased screen time, anxiety, and decreased exercise to contribute to their sleep difficulties. A meta-analysis done recently showed that nearly 50% of healthy children do not meet sleep recommendations. So let's go ahead and talk about what are the sleep recommendations. So for children ages 6 through 12, it's recommended that they get 9 to 11 hours of nighttime sleep, no napping during the day. And for children or for teens ages 13 plus, the recommendation is 8 through 11 hours of sleep and no napping during the day. And the no napping during the day, it may seem obvious, but it's pretty relevant for kids and teens who are experiencing sleep difficulties, because usually around 4 o'clock, if their body wants a nap, they're taking a nap, and that is impeding their nighttime sleep. So in working with kids to get the right amount of sleep, what I often do is I often refer them to sleepfoundation.org. I have them input the time that they need to wake up, and then we count backwards to establish what time they need to go to bed. Let's look at the impact of sleep deprivation on academic performance. So sleep deprivation leads to reduced attention span, impaired memory, poor organizational skills, feelings of frustration, being distracted, and poor motivation. Let's go ahead and look at the impact of sleep deprivation on social emotional functioning. It leads to irritability, anxiety, defiance, poor emotional regulation, anger, and problems with friends. So what's getting in the way of school-age children's sleep? Sort of like the heavy hitters, and certainly there are other things, but the heavy hitters are really parental presence, nighttime phobias and fears, generalized anxiety, electronics, and I would also add, especially recently, lack of scheduling. What contributes to sleep difficulties in teenagers? Anxiety, depression, circadian rhythm disruptions, and that's really the hormonal changes that come along with adolescence that targets them going to bed later and wanting their bodies wanting to go to bed later and wanting to wake up at a later hour. Electronics, and also unstructured schedules, I would add again. Okay, so what do we do with this problem? First of all, I think that it's really important for professionals to screen for it. So this is a really simple screening tool. BEARS, to use the acronym BEARS. So to look for, are there bedtime issues? Is there excessive daytime sleepiness? Is there awakening, or are there awakenings in the night? Is there a regularity of sleep and a regular duration of sleep? And is there snoring? Is snoring present? If there are any sort of sleep issues, a very simple and essential place to start is to look at nighttime habits. So some physical activity before bedtime, limited time in your sleep environment, which is really difficult when our kids are Zooming all day from their bedrooms. Adjust the lighting level, limiting electronics, engaging in some relaxing or calming activities, and then turning the lights out. And turning the lights out is really important. It seems very obvious, But the fact of the matter is, so many kids who I see just happen to fall asleep. It's not purposeful. They're engaged in an activity and they're doing that activity until sleep comes. And I think the idea of a light switch where we wake up, the lights goes on, and we go to sleep, and we intend to go to sleep, the lights go off. I think that that's a really important point.
I think these are really great nighttime habits that everyone's going to be able to take with them and actually try with their families tonight. And a lot of electronics actually come with some of these features built in order to try and program you to get ready for these types of habits.
Yeah. And I think that really in my practice, this is the foundation. I don't talk about teaching your child to sleep through the night without these nighttime habits, and also without an optimal sleep environment. So an optimal sleep environment is dark, quiet, in the same bed every night. That is not necessarily a given for many families. Families of young children could bed hop. Teens could fall asleep, playing video games, maybe in a different space. Anyways, cool side of comfortable and limiting electronics. So lastly, let's talk about when it's indicated to refer to a behavior sleep medicine specialist. When poor sleep is present despite the child or the parent's best efforts, insomnia in patients with medical, psychiatric, or neurotypical comorbidities, when there's excessive daytime sleepiness, when there are safety concerns, and when there are academic concerns that are related to sleepiness, and when there's a comorbid sleep diagnosis, such as a circadian-based disorder, or restless leg syndrome, or other sleep disorders.
Great. This was incredibly valuable. Thank you so much. I think people have a lot of takeaways from this, a lot of really valuable information. And we know that sleep is one of the most important things that contributes to our health, both physically and mentally. So thank you so much for contributing on that. And again, last but not least, we have Dr. Jason Berman joining us today. Jason, take it away.
Thanks, Sharon. Hopefully everyone can hear me. Good morning and welcome everyone. A huge thanks to KixCare and PTPA for putting together this really important panel, and to all my fellow speakers, and to all of you parents and families who've joined, and for sharing details in the chat about your experiences. It's really important that what you're hearing is resonating with you, and that you're able to take some tips and some information away from today. So it's always hard to go last after particularly such impassioned speakers and experts. And I come to you with a couple of different lenses reflective of a number of different roles that I hold. First, I'm a pediatrician, like some of the other pediatricians on the call, and actually I'm a pediatric oncologist, so I look after some of the most vulnerable children, and so want to spend a little bit of time talking about other health issues in the pandemic, which is a source of stress as we're trying to deliver care to all of our patients with the pandemic pressures around us. I'm a healthcare administrator. I'm a child health research leader and advocate, and so bring that lens. And important for us, you've heard a bit from Erin around research, but important to bring the research lens to this as we go forward. And also an advocate, and have an opportunity in a number of my roles to interact with a number of different levels of government. And most importantly, as a parent, like many of you, my kids have been affected by the pandemic, and one of my sons was diagnosed with a severe mental health disorder, either brought on by the pandemic or exacerbated by the pandemic. So I bring that sort of firsthand experience as well as my professional experience. So first, if we think about things from an advocacy point of view, I think it's fair to say that for most of this pandemic, children were really forgotten. And that's not unusual. In healthcare and in policy, kids tend to be forgotten in this country, and that's at local levels, provincial levels, federal levels. Maybe it's because kids don't vote. Of course, their parents vote, but they tend to be forgotten. And so really, it's only now that I think there's an awareness at the public level and sort of in the public consciousness of the impact of the pandemic on kids, both on the infectious side, which I think took a very long time, because in the first parts of the pandemic, we didn't really talk about kids at all, and the focus was on the elderly and other vulnerable populations, and then also so there's been that focus now. But of course, the mental health issues that have affected kids have been throughout the pandemic. And so one of the sayings across the pediatric community earlier on in the pandemic is kids may be the least infected, but the most affected. And now, of course, we have kids infected and affected. And so, we're seeing those things come together. And, we don't know how many waves this pandemic is going to have. But what's clear is that even once we're over whatever infection wave number and this becomes a new normal or endemic, the mental health impacts of the pandemic are going to last very long into the future and have a very long impact on our kids and on their families. And I don't say that to frighten people or to be cynical, but because we need to be aware and prepare for that. And we need to prepare for that by putting things in place now. And so you've heard from a number of experts, Leanne and Erin and Pamela, around things you can do now, but also wearing my research hat, we need to do research in the future so that we can address these needs as they evolve and problems that we don't even know what's going to come up. When we think about, what does it mean if you're a 5-year-old and you've been isolated at home and not had the opportunity to interact with your peers? What does it mean if you're a 15-year-old who loves sports and haven't been able to engage in sports in 2 years because of the pandemic? We don't know what those lasting effects are going to be, and so we really need to try to understand those so that we can prepare and address those needs. And as you've already heard, there's a shortage of mental health professionals available. And so we also need to think about that in the future, of training more individuals to be able to address these needs. And as challenging as it is to find mental health resources in cities like Toronto and Ottawa, where I am, it's even harder if you're in rural communities, remote communities, and the north. And at CHEO, we serve Nunavut. And so you can imagine up in Nunavut how challenging it is for those families who are isolated to get the help they need. And they're dealing with, many of the same pandemic issues that we're dealing with in urban centers. So it's really important to advocate to government at all levels around children's health, around the impact of the pandemic and mental health, and to advocate for both supporting clinical services now and research now to be able to address things and deliver better care in the future. Today's research is tomorrow's clinical solutions. And we've seen that with the vaccine research. And actually, one sort of positive thing from COVID is I think we've been able to see the pace of research getting implemented into clinical care has been so much faster than with any other things. Normally, as I'm sure you've all read, vaccine discoveries or treatment discoveries, many years. Most clinical trials, it takes 7 years from when studies begin to when something ends up in the marketplace. And of course, we're seeing that happen at a much accelerated fashion. And so it's allowed people to make a more direct connection between research and clinical care. And we have to remember that that really is a continuum, and we need to invest in clinical care. We need to invest in research to be able to deliver better clinical care. And it's important for our governments to hear that. Can be a bit challenging in our Canadian healthcare system, where clinical care, healthcare tends to be predominantly provincially funded, where research tends to be predominantly federally funded. And so we really need to advocate with both those groups, have people come together, break down those kinds of political silos to be able to do best by our kids and families. Now, I mentioned that I'm a pediatric hematologist oncologist, so I look after children with cancer. These kids, as one might imagine, go through a very difficult time with a cancer diagnosis, even under the best circumstances. But certainly that's more challenging in COVID when their risk of infection puts them because they're quite immunocompromised, puts them at higher risk of being unwell. And then also the mental health burden of having a fatal disease like cancer, and then being worried about COVID as well. And that's just doesn't just apply to the pediatric cancer population, but kids with many chronic diseases, whether it's diabetes or arthritis or inflammatory bowel disease or anything else, right? And then on top of that, kids who may have some other acute thing, a kid that breaks their leg or breaks their arm and has to come into an emergency room and then is worried about COVID as well, something that parents never worried about before. And so we have seen earlier in the pandemic, certainly at CHEO, and I think this was the case in Toronto and other centers as well, a delay with bringing kids into emergency rooms. And certainly there were a number of reports that came out from the US of delayed diagnosis of kids with cancer, which affected their outcome because parents were terrified to bring them to a hospital because of COVID. So I think, this impact, it's not just COVID, it's impact on other kids. And of course, now with many hospitals in ramp down mode in the Omicron wave, both adult hospitals, but also pediatric hospitals, where we're now seeing kids coming into hospital, while most kids aren't getting sick with Omicron, some are, and particularly those with underlying health conditions are. We're seeing a ramp down of services, so delayed surgeries and other treatments having impact on kids who have other health problems. So I think it's important to remember these other health problems don't go away. Brain tumors don't go away because of COVID. Diabetes doesn't go away because of COVID. Arthritis, any of these things, these kids require care. And they don't want to be in the hospital because they're worried about COVID. And then we try to deliver home care services. And then there's concerns about COVID in the home or community practitioners having COVID and access. So access to care is a really, really challenging area. And particularly now at CHEO, as in many hospitals, lots of staff, nursing staff, medical staff have been deployed to do other COVID-related things so that they're not able to work in the areas that they normally would, as those clinics have been ramped down. And we know we're going to have huge waiting lists for people to come into ambulatory care afterwards. And this, of course, isn't just a problem at our hospital, it's across the country. And how are we going to catch up? And that's going to add to anxiety and stress of people saying, my child had an appointment in January, now the appointment's only in June, or whatever that may be. So I think it's important, again, to anticipate that and to try to plan for that. So what are we trying to do to help? And so, CHEO, like Sick Kids and other healthcare institutions caring for children, we really recognize what a difficult time this is for families and children. And really, we need to help be the voice to advocate to governments, to other agencies, to make them aware of this. And like has already been discussed today, there are resources available. We have a number of resources on the CHEO website that can be accessed by anyone, and then some specific resources, of course, that serve the wider Eastern Ontario community. With the recent school closures in Ontario, we took a proactive role in providing booster vaccine to education workers, childcare workers, everyone in the education sector as an added layer of protection to try to support kids getting back in class sooner, because we know how important it is to have children in the classroom. We know that's important. That's the better way for them to learn. It's important for their mental, physical, developmental, psychological well-being and growth. And so I'm really proud to say that over a 1-week period, we vaccinated over 1,200 educators, and hopefully provided additional confidence for those individuals, their families, and their students to go back into the classroom.
That's amazing. That's amazing. And I know you were personally involved in doing a lot of the vaccine clinics.
Yeah, thank you. And I think it's important. It's important to be able to pivot and to be able to address the needs that we need to address. Lastly, I'll mention that we have a program at CHEO called One Call, One Click. This is a unique program that is an initiative of our Kids Come First Health Team, which is in Eastern Ontario and involves 60 partners and allows families to reach out a mental health practitioner by either having by calling or by clicking, and allows more personalized services to fit their specific needs. And since this program was launched in June, we've seen 2,500 referrals through the system. And finally, I'll mention on the research side, we are dealing with, we've got a number of projects underway by our investigators looking at the social impact of eating disorders and how much COVID-19 contributed to that. We know there's been a huge rise in eating disorders, how to engage youth and families in designing a mental health service plan in response to the pandemic, and then how can we use unique clinical programs like the One Call, One Click program to better personalize and provide real-time community and hospital needs to forecast and meet the needs of our families in our community. So I'll stop there. Thank you.
That was incredibly valuable. I think there's a couple of things that you mentioned. So for example, people who are kids or parents who might have been suffering from mild symptoms of things like anxiety, depression, it became so amplified during COVID where, the need for help became desperate. And I think a lot of us didn't even consider all of the things that you referenced in terms of people who had all of these other concerns that they're dealing with, whether it is diabetes or cancer, and how those delays have impacted, their future health, and even people not being able to go see a doctor and get diagnosed in a timely fashion. So I think, that brought a lot of insight that, a lot of us probably never even thought about. So thank you very much. I can't thank everyone enough, but so far, and we're not done yet, but all of these conversations and all of these tips and notes and resources have been incredibly valuable. We are so appreciative of you all. And if everyone can stay a few more minutes, we have some questions that have come in that I'm hoping I can ask you. So I am going to start with a question for Dr. Les. Is masking in school still necessary for kids?
As so many of these questions are loaded around COVID, probably the most contentious issue in all of the COVID discussions, of which there will be reams of history books written about all the discussions down the road once the pandemic is over. That's probably the thorniest issue around whether or not we should have been masking our kids, whether we should continue to mask our kids, and if so, what type of mask should they wear? I like most of us who are in the healthcare profession, who have been dealing with COVID and who have a vested interest in trying to stay abreast of the fire hose of information around COVID. I read a lot about the various issues, and I've read a lot about the masking and the pros and cons and the effectiveness and so on. My read, and let me just say what I'm going to say carefully and loop back to what I said at the beginning. These are discussions, and so we should all approach these discussions with humility and always be prepared to be wrong. So I've been wrong more times than I care to tell you since the pandemic. If I look at some of the stuff that I have written, I write a bit on the side as a hobby, really. Some of the stuff that I wrote about the pandemic 2 years ago is frankly ludicrous and laughable, and I'm ashamed that I ever wrote it. So let me just say that. But my opinion now, based on my read of the medical literature, and in an environment where we have a highly immunized population and widely available vaccines for people who are at risk, so the elderly, those with comorbidities, and our kids who have comorbidities, or like Jason's patients who are cancer patients, these blanket rules don't apply to them. Right. But in children who are living in a highly immunized society with effective vaccines widely available to those who need them, there frankly, to my read, is little evidence that we should carry on with masking our kids at school, particularly when you stack it up next to the harms that we are creating with regard to decreased socialization, decreased language acquisition, and keeping children from being children. We need to get back, in my opinion, to letting kids be kids. Kids by nature, as we all are social creatures. They need to laugh and love and hug and play, and they need to do so as much as possible unrestricted. We need to recognize the scale of the crisis, and this is why this forum has been so useful with this excellent group of panelists. We're shining a bright light on the scale of the problem that has come into view. All of these kids not sick from COVID, but sick because of COVID. And in my view, let me emphasize, in my view, the time for masking should come to a close now that we have vaccines on the scene that are working really well.
I'm sure that is going to be a controversial conversation after this call, but thank you. I think that's great insights. We have a question for Leanne. My child often says very negative, depressive comments such as, what's the point or why bother? How should I, as a parent, respond to that?
So I'm going to circle back to something I had already said, to be honest, which is finding out what the child really means by that comment. Why bother what? Why bother, getting up in the morning? Why bother doing my homework? Why bother all those things? So providing a forum for that for that to be the beginning of a discussion as opposed to the end of the discussion. I think as parents, sometimes we fall into this trap of thinking that we're supposed to be all knowing and have all the answers. And it's just not true. And as your kids get older, you get less informed, right? We don't know everything. So finding out what they really mean by that, why bother what, knowing that you are a resource to help them or connect them to resources that can help. And I think that's something that's been said multiple times, but I can't say it enough, is we need to remember that our kids are watching us and listening to us all the time. So whether it's you get off your phone, but I'm on mine, or whether it's go for a walk, you need some exercise, but you're sitting there eating a bag of chips yourself, or finally being able to have these conversations. So being really honest and upfront about the fact that everyone is having struggles. So really I always like to think of it as being a detective. What do you mean by that? And sometimes what we find out is it's a small problem and not a big problem. It's just magnified in the kid's mind, so that we can find a way to help them in a really practical manner. And another lesson we can teach them is, if we don't know, asking for help is a sign of strength. That ask, if I don't know, I'm going to help you find that answer, because that is how we can build community and help each other, because none of us know everything.
Absolutely. Absolutely. I'm really focused on the potato chip thing because I'm a potato chip addict, and just the thought of having to share, I'm getting anxiety just from that, but thank you very much. A question for Dr. Romanchik. Aren't all kids anxious now? And when should I become concerned about their mental health?
Okay, good question. So absolutely, as I mentioned earlier today, we have seen a dramatic rise in anxiety in children and adolescents. And certainly to an extent, the increased anxiety during times of uncertainty, especially prolonged uncertainty, is normal and expected. However, if a child is experiencing anxiety symptoms that get in the way of them doing things that they need to do right now, so getting to school, socializing with peers in a safe way, taking care of themselves, their hygiene. So if you're noticing that the anxiety is actually interrupting or interfering with some of those, day-to-day, everyday activities, then that's when we would think that the anxiety is probably a bit higher than what we would expect at the moment. So that's when we would suggest having them seen by a family doctor or pediatrician, and possibly a referral to a mental health clinician.
Thank you very much. Question for Dr. Berman. Are you seeing many children with COVID being admitted to hospital currently?
Thanks, Sharon. I would say that most kids that are coming into hospital are not coming in because of COVID. Some of them are found to be COVID positive, but mainly are coming in for other reasons. But having said that, I would say that the Omicron wave has been different compared to all the adult hospitals in Ottawa. CHEO did not have a single outbreak of COVID until Omicron. And then we've had a couple of small outbreaks, one in our ICU and one in one of our inpatient units earlier in January that were well contained. But I think that is reflective of what people are seeing with Omicron and its impact on pediatric populations.
Okay, that's great. So I know we have a lot more questions, but unfortunately, we are nearing the end of our time. So on behalf of myself, a parent tested, parent approved, I really want to thank everybody for participating, for asking questions, for being a part of this. You know, I've been looking at the participant numbers and people have stayed from beginning to end, which I have never seen in a Zoom. Thank you, KixCare, for allowing us to be part of this. And Daniel, I will let you take it from here. Thank you.
Well, thank you very much, Sharon. What an amazing MC, and to all of our speakers. Like, this conversation was very much overdue, and certainly better late than never. You know, the response was just outstanding, from including people who couldn't make it today, who asked for the recording, for the 120, 130 people who attended, and as you mentioned, Sharon, everyone hung with us right to the end. So just a very sincere thank you to Dr. Pam Middleman, Dr. Catherine Smart, Dr. Erin Romanchich, Leanne Matlow, Dr. Ed Less, Dr. Jason Berman, Dr. Harley Eisemann. We've all gotten to know each other for the past months or years. And the work that you do, whether it's in the community, in the hospitals, now online, is just, you're all lifesavers. And the work that you do is just so important to raising healthy, happy kids. And on behalf of parents right across not only Ontario, but right across the country, who are either watching this live with us now, or I'm sure will be watching in the future, we are very grateful. So thank you for spending your valuable time with us today. I also want to again thank PTPA, Sick Kids, CHEO, and our entire team at KixCare for really leaning into Bell Let's Talk Day and really doing something so important which is talk about kids' mental health alongside adults' mental health. Our sponsors, Mastermind Toys and Daddy Digest. Mastermind was generous to donate a gift certificate to one lucky winner, and I actually did the draw a couple minutes ago. So Sharon Petipak Cole, congratulations, you've won a $500 gift certificate to Mastermind. As well, through our partners, through KixCare, through Daddy Digest, and hi Zoe, thank you so much for your participation. And Sharon and her team at PTPA were able to donate $1,000 to support mental health research at Sick Kids and CHEO. So thank you both for the world-class organizations that we have right in our own backyards and the amazing leaders that are there. So just to share deep appreciation for everyone here, all the panelists, all the speakers, the hosts, and all of you for attending. We will make sure that after this event, everyone gets a video of it. Please watch it, share it with your kids, share it with your friends. Everyone should see this content. And we will also be creating a very special PDF, which encapsulates a lot of the great wisdom that we all heard here today, especially actionable steps, because everyone needs a little bit of help right now. And if we're able to continue to have these meaningful conversations and do it together, our kids will all be better off for it. So a sincere thank you. And we did it under time. So thanks, everybody. I look forward to continuing the conversation. You can check us out at KixCare.com. That's KixCare.com, or our partner PTPA.com. Thank you again, everybody, and have a wonderful day. See you soon.
Thank you.
Bye.